My mother and my father were both addicts. My mom died when I was 8. My dad was murdered when I was 16.
Loss and loneliness led Kristen Sabana down a long path of addiction.
Once I wasn't able to get those from a doctor anymore, then I switched to heroin.
15 years of darkness.
You don't know until it's too late.
Finally clean for 3 years. And then
I used for 5 weeks while I was pregnant with him.
She relapsed until the moment she felt her son kick for the very first time.
It didn't bother me that I was hurting myself, but it bothered me to know I was hurting him.
So she denied her shame and fear of arrest or legal retribution and sought help, only to be turned down by a major hospital here in Indy.
I felt like there was just no hope.
That's not an uncommon occurrence for addicted pregnant women. Treating them is, after all, tricky. And that's when she found Dr. Tara Benjamin with Riley Children's Health.
I feel as though they are the lost and forgotten of this epidemic.
She's passionate about treating addicted pregnant mothers, especially as she's recognized very few physicians take on their cases. For Kristen, that treatment meant prescribing Subutex, a drug to minimize withdrawal side effects.
There aren't that many doctors in general that have certification to provide medication-assisted treatment.
But that's when the real hard work starts. Therapy, classes, time for healing.
Pregnant women are the most motivated of any to get sober and clean. And so I think if we start with a population that is very motivated for sobriety, we can make a huge dent in this epidemic.
And the numbers show there are plenty of pregnant women to treat to be a catalyst for change. At any given time, Dr. Benjamin says she treats 60 to 70 addicted mothers. And since the summer of 2015, she's treated nearly 300 patients. Of the women Dr. Benjamin has treated, 95% are Caucasian. Most are in their 20s and early 30s.
It's hard for them to seek care. And once they do, we should grab onto them and encourage them as much as we can to continue to get prenatal care.
Because this is the result. Moms and babies alive, together on the road to recovery. Just like Kristen, who says she only wants what's best for her baby, Juna.
Even though you feel ashamed, because it is a shameful thing, not to be so ashamed to get help, because it's worth it.
In Indianapolis, Beth Vaughn, RTV6.